Here. Okay, hi, welcome to Living in My Shadows podcast. I'm Sandra Wallace. I'm a anxiety, OCD, and depression coach, and every month we bring on a guest speaker to our gathering place. And this evening's guest, I'm happy to introduce, is Dr. Harold Heater, DC, who has been in practice as a chiropractor since 2010. He has also been part of the Joint Chiropractic Network since 2020. He earned his Doctor of Chiropractor from Life University College of Chiropractic and is dedicated to helping individuals shift their perspective on health, empowering growth and vitality through a natural nerve-centered approach. He has experience addressing a range of conditions, including migraines, arthritis, sciatica, and chronic pain in both the neck and back. Dr. Heater brings a passion for individual care and a lifelong interest in holistic well-being. So thank you very much, Dr. Heater, for being with us this evening.
I appreciate the invitation. I look forward to speaking with you and your audience.
Yeah. So what we have done is we've compiled some of the more common questions that we get and that sometimes the general public asks. So I'd like to take liberty to ask you each of those questions. We've got 5 in total. If something else comes
Okay.
up or our audience wants to ask questions as we're going along, just feel free to raise your hand or go down to the little react bar. If you don't have that, just put your hand up and I will address your questions as we go along. If that's all right with you, Dr. Heater, could we address them as we go, or would you prefer it at the
That
end?
that sounds fantastic. However you'd like to do it. I'm a big fan of answering questions in real time. In fact, that's
Yes.
one of the benefits of the new program that I'm launching is that
Ah,
people can interact with me and ask questions real time so their brain's not stuck on something that they don't quite get.
uh,
And then they would miss the content that comes right after it. And we don't want that.
yes, that's right. And I always say if I get stuck, then I'm not able to process what you're going to say next. So I love that. So we'll start with
Yeah.
the first question. How would people know if physical misalignments could be contributing to mental or emotional stress?
Well,
Thanks.
that's a great question. There's really a couple of ways to approach that. One is from a more scientific standpoint. One is from a more common sense standpoint, and that's the one I like to use, and that's the one that resonates with my patients.
Mm-hmm.
So to understand, I ask people if they have any healthy habits,
Mm,
and they do. And I'll say, well, what are they? Well, I brush my teeth, I try to exercise and eat right, and so forth. And what I like to do is highlight the fact that folks were taught to take care of their teeth, their dental hygiene in
mhm,
a proactive way. They were taught to take care of their hair and their skin, showers and shampoos. They were taught to exercise and eat right,
mhm,
right? We want good cardiovascular health, muscle fitness. It's
mhm,
good for the soul as well. Okay.
mhm,
Well, the spine and the nervous system are body parts, aren't they? What's their
mm.
routine maintenance schedule like? And what impact would that have on the body if it wasn't followed?
Right.
Right.
Hmm.
And so that's where I start with people, and I'll ask them on the very first visit. I'll actually use their some research along with their age and the lifestyle that they've told me that they've lived, and
Hmm.
I will estimate how many chiropractic adjustments they should have had for their spine and their nervous system up until the day they walk into the office.
Hmm.
And it shot, they go, wow, that's a lot. And I say, well, let's not worry about the number right away. Let's just talk about why there's a number at all.
Hmm.
And then I explain to them that you have a body part. And I'll ask them a simple question, an A or B question, which makes sense to you. A, you never have to take care of your spine and nervous system a day in your life. You're born with it. It works great forever, 100 years or whatever. You're good. Or B, just like every other body part, your spine and your nervous system have a routine maintenance schedule that you
Hmm.
should follow. even when it's not giving you grief, to maintain it in health.
Mhm.
Everybody picks B. Oh, my hand went up. I'm going to drop that down.
I was just going to do that. Thank you.
Yeah, there we go. Um,
And
so
MJ could do it too.
so that's how I approach it. So they go, oh, okay. So what I do is I highlight for people that it's not
Mhm.
just what you do that might get you into trouble health wise, but also what you don't do.
Yes.
Right.
Mhm.
And we're not taught to look at that necessarily. We're not taught to look at what we don't do. So
Mhm.
I think it's really important to highlight that. So when people will often ask, as you did, well, why? Like, why do I have this issue when I didn't have any obvious accidents or injuries? Well,
Mhm.
it can simply be inattention to a body part or body system that's designed
Mhm.
to regulate that stuff and keep it working well. And if you
Right.
didn't know you were supposed to do it and you never did it,
Mhm.
that's the first place we want to start.
Right. Yeah, good point. And also things usually would it be fair to say sometimes by the time someone comes to you in your clinical setting, they've already been living with that specific concern for quite a while and it's sort of caught up to them at this stage. So it's not something that's just happened like yesterday. Sometimes it's things that they've had need to address long time ago before they actually sit down with you.
100%. I call it ASOT,
Yes.
accumulated stress over time.
Ah, I like it. I love acronyms. That's how I retain. Good. Yeah, that's a good one. And when you were talking about when you first sit down with someone, it
I'm going
makes
to
me
take
think
this one
about
out.
the importance of a really good, thorough assessment to begin with. And a lot of times, the questionnaires that come on the for initial appointment, people will often quickly check and say, not applicable, not applicable. But really, in reality, those questions are being asked for a reason. They may not see it as something that's connected, but as you work with them and you do that good snapshot overall picture, you're able to better help and serve that person. Would that be correct?
No, that's 100%. And I really I like to dig a little bit with people and I ask them
Mhm.
questions that are a little unconventional. A lot of chiropractors in their
Mhm.
experience are very, I'll use the word mechanistic, more musculoskeletal and looking at the body sort of as just like a watch, as a group of parts that
Mhm.
just sort of work together
Yeah.
mechanically. But there's a huge energetic component. I mean, we're energy beings, right? In a physical body. That's my take on it. And
Mhm.
so we can't divorce the mental aspect of life, the energetic aspect of life, and how that impacts our health, and
Mhm.
also on how that can be positively affected by certain ways of intervention, right?
Mhm.
Chiropractic being one of them.
Right.
So yeah, it's extremely important to ask questions like, what's your, are you a high stress or low stress person? The 6 inches between your ears,
Mhm.
how do you look at that?
Mhm.
Do you
Yeah,
think
good one.
you've got it well under control, or do you think maybe it could use some work? Because that's a
Mhm.
big deal.
Yeah, it is a big deal. And usually symptoms will show up. The mental concerns often I find people will display them in physical ways in nature. So they'll complain of migraines or headaches or pain or stiffness because we carry a lot of that stiffness, including myself, my posture and the way I slouch. But a lot of times pain and stress will show up in the physical ways, but it's contributed initially from the mental aspect. So can you share maybe an example of someone that might have come into your office with anxiety? Like you may not have known it right away, but maybe anxiety has showed up in different ways in their life, and now they're having back pain or spinal problems.
Oh yeah, that happens quite a bit.
Mm,
As soon as I mention something like that, people their wheels start turning and they start thinking about, oh my God,
mm,
why? Okay, now I understand. There's
mm,
a nerve, cranial nerve 11, that
mhm,
it's in the brain stem and it goes right to our traps.
mm,
Okay, the upper shoulders. And you know how everyone says, "Oh, I carry all my stress here," right? Well, there's a reason for it, right? Because that's how we're physically wired, is
mm.
for those muscles to fire, and all of a sudden you've got your shoulders as earrings, right? And you've
Yes.
got muscle tension, and that can lead to, neck tension. Obviously, it leads to jaw problems, can lead to headaches, all sorts of those. types of scenarios can result
Mhm.
from a mental upset. I use the example, and I'll ask people, and usually they say no, they don't like public speaking. I'll say, "Do you like public speaking?" Like, would you talk to 1,000 people? And they're like, "No, no, no, no." I
Mhm.
said, "Well, okay. What if I was talking on stage and you were my assistant? You're sitting down there in the front row, and you've been with me for 2 years. You've heard what I'm saying to this group of 1,000 people over and over. You know it inside out. What if
Mhm.
I just made a casual remark partway through the presentation one day and said, 'Yeah, I'm going to bring my assistant Sandra up here. She's going to
Mhm.
talk to you for a couple minutes, and not right now. Just take it easy. I'll get to you. Just sit there a few minutes, right?' And then I go on, right? What are you doing in the next couple of minutes while you're waiting? You're freaking out, right? Your nervous
Yeah.
system is going crazy. Your
Yeah.
your palms are going to sweat. Your heart is going to race. Your muscles are going to get tight. Your brain
Mhm.
is going to get foggy. All these
Mhm.
different aspects of the stress response are going to kick in, and they're going to change how your body works. And the
Mhm.
stuff that people don't realize too, because they feel that,
Mhm.
right? You would feel that. But
Yeah.
the three body systems that take the most amount of energy are the immune system, the digestive system, and the reproductive system. So in the background,
Mhm.
while you're freaking out because your mouth is dry and you can't swallow,
Yeah.
right, your immune system is starting to not shut down so much, but it's going to lessen its effectiveness. The body's
Mhm.
not going to devote as much energy to the immune system because it's not worried about fighting an
Mhm.
infection or something. It thinks you might die because your body is freaking
Mhm.
out, right? Your
Mhm.
digestive system is going to decrease its function because it's not worried about digesting your lunch right now. It's got bigger
Right.
worries, right? It
Yes.
needs to conserve
Yeah.
energy, and the same with the reproductive system.
Yeah, I love that example. And people often that only escalates the anxiety when they start feeling different ways the body's responding, like that fight, flight, or freeze, I think of as well. And people start
Hmm.
thinking, what's going on with me? Because I'm physically not feeling well. But our body is always in that protective mode. It's always trying to stay in that survival mode. And it's sending different messages to different parts of our body. So I love that you said that. Now, that kind of leads us to the next question is signs of physical misalignments. And again, we're talking about things in general, but maybe even be able to answer that from an anxiety, OCD, depression perspective. Like what are some of the symptoms that show up in your clinic on a like misalignment physically?
Hmm. Well, do you know Bob Proctor? You familiar with Bob Proctor?
Oh.
He was he's an author and a speaker, and he had a really great insight. Years ago, I learned that everybody has a weak link,
Mm-hmm.
right? We're all unique. We have different, our anatomy can be very different based on how we were born or how we lived our life.
Mm-hmm.
Our stressors are different, how we handle them are different, how we approach them are different. So people can have almost any physical symptom that's associated with a mental upset. Nightmares actually is an interesting one, where
Mm-hmm.
if people are having nightmares, we've found through just general experience in the chiropractic office
Mm-hmm.
that there's an area between the shoulder blades, a little bit below it, that is closely connected to nerves that connect the brain with our organ system, and in this case,
Mm-hmm.
specifically the liver. And so, if the liver is not detoxing the body the way it's supposed to be, then it follows that toxins may be building up, and they may be
Mm-hmm.
building up also not just in the blood, but they some of them cross the blood brain barrier,
Yeah, blah, blah,
and
blah.
and actually people have had nightmares. I've had patients where they had
Wow.
nightmares, and when they were adjusted, their nightmares stopped,
Wow. That's
and
interesting.
they were shocked and like, well, and this comes back sort of to a fundamental idea around
Hmm.
chiropractic and chiropractic care, which, everyone's so centered on the spine. Everywhere you look, there's bones in the spine and bones in the spine. But really, the big deal is that the bones in the spine, they protect the spinal cord and the nerves, right? And those are the
Hmm.
those
Yeah.
are the wires, if you will, that communication highway
Mhm.
between the brain and the body.
Yes.
So if those aren't if those nerves aren't firing properly and working in sync with each other, then you're going to have all manner of upsets, whether it's a physical problem or a
Mhm.
mental problem.
Yeah.
And the nervous system, right? That there are 11 systems in the body. The nervous system is one of them, and it
Mhm.
controls and coordinates the functions of all the other 10.
Mhm. So amazing. Yeah.
And that's why some people can get such dramatic changes. For example, my nephew is on the spectrum. He's um, uh, Asperger's, I would say.
Okay.
And he sees a chiropractor on a regular basis. He's 3,000 miles away, so I don't get the privilege of adjusting him, but
Yeah.
he sees a chiropractor on a regular basis, and his mood and affect is much, much better when he's getting adjusted.
Hmm.
I've had some colleagues in San Diego who just specifically worked with kids with neurodevelopmental disorders and so forth, and they got wonderful results with
Yeah.
the kids once their nervous system was balanced. It was able to more properly regulate their mood and their activity and their hormone releases and so forth.
Yes.
And so it really kept them on an even keel.
I love that because even though we're not diving into that tonight, but even the whole parts of the different parts of our brain that are affected, like the prefrontal cortex and the
Hmm.
the hippocampus and the brain stems and all that, it's all intertwined. So it does help regulate our emotions and our ability to lessen our stress when we deal with it holistically. So really good. I'd like to pause right now. Is there anybody that has a question like we talked about a lot, we covered a lot in just two questions, but any feedback or comments you'd like to make, please by all means. Anybody? Nobody? Not yet. Okay. All right. Well, yeah, you do, MJ? Do you have a question now? Okay. And then the third one is the impact of chronic conditions on mental health. Like maybe more specifically, again, the word chronic, because often there are things happening that are chronic in nature. So can you elaborate on that?
Sure, that's so exhausting for people
Mm,
to have to deal with a chronic condition. And what I've found is it's not just the pain itself. It's the it's the thought that what am I going to do to fix it? Because most people are going to seek medical care first. And a lot of times that is not sufficient to take care of the problem.
mhm,
And now they don't have options. And that's part of the reason I put my program together is because I want to show people that there are options. It doesn't mean 100% that it's going to
mhm.
fix you. Okay.
Right.
But
Yeah.
but number one, there's hope. Okay. And there's a possibility that these unresolved health conditions, even things that you wouldn't normally connect with a chiropractic adjustment, because most people, to be fair, headaches, low back pain, um, um, neck pain, that sort of thing, it's an easy line for them to draw. But when you start looking at other things like anxiety, depression,
Mhm,
mood swings,
mhm,
you know, those are dysregulations inside the body that can normalize and do normalize,
mhm.
not in every case, but
Yeah.
can absolutely normalize. And it's really fatiguing, I think, for people to not be heard
Mhm,
and for people to feel like they're just being sort of rushed into
mhm,
a pill
mhm.
or some sort of, well, you just have to live with it sort of
Yes.
thing. And when you feel you don't have anywhere to turn and you're 26 years old and
Hmm.
you get this chronic pain condition, you're
Yes.
like, I just started my life here.
I know.
Like,
Yeah,
what
exactly.
what's going on? I
Yes.
don't want to live with this.
Hmm.
If I could tell you a quick story about
Yeah, please. Please
about a
share.
baby, we had I had a patient several years ago, probably good 10 years ago now, and she brought her 12-week
Hmm.
old daughter into the office. This daughter had her fist clenched, her
Hmm.
head back, and she was screaming and crying almost nonstop since she was born. And the
Hmm.
only time she would stop crying was when she was too tired.
Hmm.
And this mom was in her mid 20s. She said she went to all of, the pediatricians' referrals and all these different doctors. And what she was finally told was, you're unlucky you have a grumpy baby.
Hmm.
That was the final diagnosis. And And so she was lost and she talked to a friend of hers who was a patient in the office. Fred said,
Nice.
go see the doc. Have him at
Nice.
least check your
Yeah.
daughter and see what's
Nice.
going on. So we checked her. Naturally, we found because birth is a very traumatic time in a
Mhm.
person's life. So, we found areas in a 12-week-old baby that need to be gently adjusted, and we did it.
Mhm.
And about an hour or so later, the mom calling us, and she
Wow.
was sort of in panic mode because her baby wasn't moving and she thought there was a problem. But her
Oh.
baby was breathing, her
Mhm.
baby was pink, her baby was
Mhm.
warm, her baby
Happy,
was sleeping.
content. Yes.
Her baby was sleeping.
Finally. Oh,
And
beautiful.
she was beyond grateful. Can't even explain.
Oh.
She fired her pediatrician because her pediatrician read her the riot act for taking a 12-month-old, I mean a
Yes.
12-week-old to a
Yeah.
chiropractor. And because they
Hmm.
just didn't understand that you don't adjust a 12-week-old baby the
Yeah,
same way you adjust an
that's
adult
right.
or even a
Yeah.
middle schooler, right?
Mm.
And so you talk about the mental relief for mom as well
Mm.
is
Hmm.
huge.
It's huge. Yeah, it is so huge. I love that story too. And that's why I brought you on to Dr. Heater, because I believe in chiropractor so much that not only from a personal perspective, but I've heard what it can do for other people. So the more we can educate people just to keep an open mind and be open to ideas. And that's what's
That's
great about
all.
you. Hmm. That's
That's
really
all I
good.
ask.
Yeah.
Is people are open mind. You're not going to make anyone do anything, right?
Right.
But
Yeah.
if you present what you know to be true
Yes.
and you give them an opportunity to consider it,
Yeah.
if they have an open mind and they're
Mm.
not, digging their heels in because of things they've heard
Yes.
elsewhere, then, they have a chance to really take advantage of something that's new to them. And it's
Yeah.
fantastic. It's like that old commercial. I don't know if you've ever seen a V8 vegetable juice commercial, but it was something that was big
No.
in the 60s and 70s in the US. And someone would have like coffee and a muffin or something and whatever, normal American breakfast, and they were sluggish in the morning or grumpy when they came into work. And someone else was all chipper and everything else. And they're like, "Oh, what did you do? Why are you so happy?" Right? And they
Yeah.
go, "Well, I drink V8 vegetable juice. It's full of vitamins and minerals and blah, blah,
Yeah.
blah." Right. And then at the end of the commercial, the person would hit their head and they go, "Oh, I could
Yeah,
have had a
a
V8."
V8.
Right.
Yeah, I
And
remember that now.
and yeah, and that's kind of what I see in the office with people who have an
Yes.
open mind and they understand. They're like, "Oh, you mean I could have been doing chiropractic the last 35 years?
Yeah.
I didn't,
Yeah.
why didn't anyone tell me?"
Why didn't yeah.
You know,
Better late than never, though, right? For
better late
some
than
people,
never.
yeah. Excellent. So the fourth question is lifestyle habits and wellness practices. Now, this encompasses a lot of different things, but is there some practice that you recommend to people based on the clientele you have or what you feel is because there's lifestyle habits, just like when we use the word diet, like people get kind of get intimidated by that word, right? So using even
Sure.
the words, like each word has a different connotation, but lifestyle habits is probably a better way to define it, and wellness practices, and that can mean a lot to many people. So what are your thoughts on it? Because I really want to hear your perspective.
Sure. We in chiropractic we look at five pillars of health. I've heard, everyone's got 4 pillars, 6 pillars, 5 pillars. We look
Hmm.
at 5 pillars of health. One is going to be your nutrition. One is going to be exercise. Everyone knows diet and exercise. Whether they do it or not is another issue, right?
Hmm.
Mental fitness, very important. So have a good mental relationship with your relationships, with your finances, with your God, with your work, with your play, right?
Yeah.
With yourself. Um, Number four, sleep. Can't
Mhm.
overestimate or overemphasize how
Right.
important proper sleep is. And then fifth is a healthy nervous system through chiropractic care, so that those other four healthy habits can be properly integrated in the body and the body can do something with it. And so
Nice.
I'll ask people to look at those five. And sometimes, I'll ask questions like a question of the day. Out of these 5 areas, which one do you think you got really dialed in? Oh, my exercise, doc. I'm in the gym 8 days a week. Cool. Okay. Which one do you think you need a little help with? Right. And they'll say, well, I get a lot of stress in my life. All right. So then we look at ways where people can unplug a little bit. I'm a huge fan of a digital detox. I do
Oh,
as much as
yeah.
I can to use technology sparingly. It is
Mm-hmm.
pretty ubiquitous and it's important for a lot of stuff these days. So it can kind of creep up on us when we're not paying attention. But getting all the electronics out of the bedroom, whatever it is, right? I think is a huge thing.
Mm-hmm.
Mentally and emotionally. Plus, it has been shown to help you sleep better.
Yes, yeah.
Personally, I like meditation and visualizations.
Mm-hmm.
So I do those, even if it's 5 minutes, and I do a 20 or a 25-minute one daily. I just pick a different one. And to me, it's a huge reset where I can just dial my brain down, stop thinking, and just take a breath. It's
Yeah,
like I swear to God, we barely even take a breath
I
anymore these
know.
days. You know what I
I
mean?
know.
It's from one thing to the next. I don't know about you, but like the parents that come to my office, they're like, what'd you do over the weekend? Well, my son had a play date, so we drove him up there. I'm like, wait a minute, your kid's 18 months old. Yeah, but he had a play date and it took us half an hour to get there and it took us an hour to get back because of the traffic. I'm like, holy cow. Like if an 18-month-old has a schedule, right, in a calendar, social calendar, no. 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 So I really encourage people to look at it because they say, oh, my schedule is terrible. And I'll ask them, well, who made your schedule?
Yeah, good. Yeah, that's a good one.
Well, yeah, I guess I did. All right. Well, I'm not picking on you, just
Yeah,
asking you to own it. If you
yeah,
want to keep doing it, keep doing it. It's your life. It's your
yes,
journey. But, if you're saying, hey, maybe this isn't working quite so good for me,
yeah,
maybe take a
yeah.
look at it.
Nice. Yeah. Process of elimination. What's urgent on the schedule and what can wait or push back or setting to, I think even blocking our days out is helpful. I'm learning more about that. Like, what are you prioritizing each day? And the whole downtime from electronics. Because I know that our next diagnostic statistics manual, which is our psychiatric Bible for diagnosing, is
Sure.
going to have cellular phones and electronics and social media as a diagnosis. That's the word I've been
Interesting.
hearing, and it makes sense to
Huh.
me because not being able to detach from those things, just always worried about that. So again, the long-term ramifications of that can be devastating. So thank you. And then the last question I have is the whole list the what message would you share as far as a holistic health message goes as a chiropractor?
Well, I, I would ask people to understand that there's no silver bullet really. If you look at how we live our life, we can live 100% function. Let's say 100% functions over here, and that's perfection.
Hmm.
Everything in the body working perfectly. And on the far end of the spectrum, you've got 0% function, means we're dead. Okay.
Hmm.
All of us live somewhere in between.
Hmm.
And so my advice to people is to just make choices that move you more toward the 100% and away from the 0%.
Nice.
Because there's
Yeah.
no meter we can really hold up to people and say, like you're 48% healthy, you're 96% healthy. Um,
Hmm.
but you can make choices that move you more towards one end of the spectrum than the other. And this whole idea of like a cheat day, like if you're on, like you mentioned, the diet thing, right? So if someone
Hmm.
is really changing their food habits and everything, and they're like, oh, I'm going to make a cheat day and I'm going to eat something like that I know isn't good for me. I
Hmm.
tell them to just call it a treat day instead of a cheat day because
Yeah,
they're doing great work during the week. If 6 out of 7 days you're really knuckling down and you're paying attention to being able to,
that's right.
whatever it is for you, right? It
Yeah,
might not be food, it could be something else, but
for
but
sure.
rather than, because cheat sort of has like a guilt thing attached to it. And so
Yeah.
if you make it more like a reward for all your hard work, thank you very
Hmm.
much,
Yeah.
it's a little bit more mentally uplifting. And personally, I think it's a little more appropriate way to look at it anyways.
Yes. Yeah, very true. And I love the continuum thing, like, because life is happening all around us, right? And sometimes our mental health can be over here on the continuum, and then it slides over here and then over here. So we have to be kind to ourselves and we have to be gracious in doing the things that you just mentioned. I think this has been so wonderful. Before we kind of wrap things up, does anybody have any questions or comments they want to just share something? Oops. Anybody?
I would just, oops, I'm pushing the wrong buttons here. I was
Go ahead, HJ.
Hi, yeah, thank you, Sandra, and thank you, Dr. Heater, for this incredibly insightful forum. I've really enjoyed it, and I'm just curious to know, like, I've been in healthcare for pushing 30 years now, and of course, we're here in Canada. I get that, um, systems are different and so forth, but one of the barriers that we have here to, I think, any disciplinary care is third party payers. I just wonder if I guess I know your system is different down there, but um, is there, and I think just to extend that one thought further, is that it's resulted in a large disconnect between our disciplines. So, like, where, I mean, I personally had the experience of going to a doctor who's denounced, other forms of medicine, be it indigenous medicine or Eastern medicine, whatever it is. So, how do you find that down there? Do you find that in California? And would you be able to comment on that for me?
If I can rephrase the question, because I'm not 100% clear on it, but this is what I think I heard, is um, do we get properly reimbursed for what we do in the best
Um,
interest of the patient?
Not so much that the reimbursement, I think, looks after itself, but in most cases. But do you find that there's a disconnect between disciplines? Like, people come in, they've
Chiropractic.
tried Western medicine, they've tried acupuncture, now they're trying chiropractics, they've tried, or is it more of a holistic
Okay.
approach and
Yeah, I think I understand. So more like will medical people refer to chiropractors as part of their care? Is that sort of what you're asking?
yeah, like right here, like in Canada, it's only in the last, like in my time as a pharmacist practitioner that we've seen these, sort of divisions disappear, right? So that we support one another discipline to discipline. And I'm fortunate to work in an environment where, all the disciplines support one another, which is very refreshing, but you don't see that very often to be in Canada, I don't think so.
Yeah, nor in the US, really.
Mhm.
The medical community, for the most part, in my experience, stands apart
Hmm.
from other types of interventions. And there's probably a long, long podcast or conversation just for this one topic, but
Yeah,
it's 100 years old,
yeah.
the disconnect between the healing practices in the United States. The traditional Western medical approach has been, in my opinion, commercialized to such an extent
Hmm.
that there's there's little room for patient care to trump profits
Yeah.
and other types of concerns that are maybe political or business oriented. So it is frustrating in that regard to have to, confront that, but it is what it is. And so as a profession, we do all we can to embrace the medical people because they do what we don't do.
Yeah.
Hmm.
I'm not going to start giving people advice on their heart condition or kidney condition or something like that. I'm going to internal medical doctor. But and by the same token, we would like to think that when someone presents in the medical office and they have something that clearly is can be helped with with what we do in chiropractic, would like the same, type of open-minded
Reciprocity.
referral.
Hmm.
It's pretty rare.
Hmm.
It happens,
Yeah.
but it's unusual.
Yeah. Yeah. No, that's very interesting. So yeah, I don't want to dominate the time here, but once again, thanks very much for your insight. It was a real pleasure listening to your talk.
No, of course, you're welcome, HJ.
Thank you for the question. And so, with wrapping up, I would like to ask you, Dr. Heater, is there anything that you're working on right now that you'd like our audience to know about? Contact information, websites, whatever you want to share. What's happening with you? Because I know that you're working on some great, great, great things.
Yeah, yeah. I recently put together a program that actually is aimed at two different demographics. One is the family wellness chiropractor that's
Mhm.
looking to educate their new patients so that the new patients can understand more fully what chiropractic can do for them. That makes them a better patient. They get better results in the office, and
Mhm.
there's a history of family wellness chiropractors educating their new patients. It's just hard to get all of them together to do that. So I've created a program. I call it Headspace Before Habits. And the goal is to share with people a perspective on health that's more successful than the one that's currently more universally accepted in the States. Let's put it that way.
Yeah.
And we want a healthier perspective, a healthier way to look at the body and how health works. And at the same time, I want to incorporate a little bit of information about chiropractic so that people can more fully understand, hey, if you've got a digestive upset or you're prone to miscarriages or your blood pressure is poorly regulated, don't discount chiropractic
Mhm.
as an option for you because these things can and do get better. It doesn't mean it's a lead pipe cinch for every person who walks in the door. That's why we do an exam and a history and so forth. But all these manner of conditions can improve and do improve
Yeah.
with chiropractic care. So I've put this program together. Like I said, it's called Headspace Before Habits. And the lay people, the public can come to the class and they can learn about health and they can learn about the possibility of chiropractic as being that missing piece for them. Because a lot of people do have unresolved health issues and they've
Mhm.
gone through the traditional Western medical route and they've only gotten so far. Maybe they've gotten nowhere, maybe they got a little better and they plateaued. But there's some residuals there and they're sort
Mhm.
of stuck. They don't know where to turn.
Right.
And
Yeah.
so my job is to educate them and help them understand, hey, you've got an option. Where do you live? Oklahoma City, great. Go to your local chiropractor and get checked out. you know.
Yeah.
So
Excellent.
that's what I'm and the web address for the website is simply newpatientclass.com. It's as
Mhm.
simple as you can get, newpatientclass.com. People can get on there and they'll immediately see a little pop-up and it'll say, are you a family wellness chiropractor looking to educate your new patients, or are you a health seeker looking to make yourself better?
Yeah.
And you just click on one of those buttons and it takes you exactly where you need to go and you can get some information that way.
Excellent. I can see a book in the making.
Oh, you
I could
do?
I could see you creating and publishing a book on that very important topic. Have you given that any thought?
A little bit of thought.
Yeah,
It's
give it a lot of thought because I think it's needed. The world needs you. So, and along
oh,
that, I want to just ask you one last final question, Dr. Heater.
sure.
On Highway 8, one of your busiest highways where you travel, there's a
Yes, it
billboard
is.
and you own it. You own
There
that billboard.
is. I do.
Yeah, you do. And there's
That's
some
awesome.
neon funky lights shining off and on at nighttime, and it's out there
Okay.
for the world to see. What is
I like
gonna,
it.
what is showing up on that billboard?
Oh boy. Well, definitely my face and my web address so they could find that. Um, but what else would be on there? I'm big on perspective. And so there's something I heard from Wayne Dyer years ago. And I don't know if he invented the quote, if I attribute it to him. I don't know who really deserves the credit, but it he used to say when you change the way you look at things, the things you look at change.
Mm,
And
beautiful.
so it's a matter of perspective. And if I can get people just to have an open mind enough where they can look at health from a different angle, slightly different angle, okay, and see if they see something a little bit different. And
Yeah.
that will, inform future decisions and, you know, maybe be a great thing for them.
Yeah, wonderful. Yeah, I think you've definitely opened up my mind, and I'm sure everybody that's listening to you right now has a very different perspective and will think twice about maybe their options because it's all about choices. And thank you for choosing to be with us tonight. We value your time and we value your insights. So, with that, we will have this recording up on YouTube and on our different social platforms. You can visit us at www.theocdcoach. I'm Sandra Wallace, and if you want to reach out by email, you can always reach out at info at theocdcoach.com. And stay tuned for our gathering place at the end of September, our next gathering place. MJ, can you just share the date again? I don't have my phone with me. The last
September 11.
the last Wednesday of the month in September. September 20, is it 23rd? I think it's 20. I should have had it written down, but we
September
meet
24 is the
24th.
last September.
Thank you. So Wednesday, September 24th, we'll meet again for our gathering place. We meet every last Wednesday of the month with a guest speaker. So on that evening, we will have Mario from Australia, who is going to speak on empowering men to be able to overcome their destructive behaviors. So we're really excited about that. And then we have podcasts throughout the month. So stay tuned, look and check us out and follow us on YouTube. And until then, we will meet you there. Bye for now.
Thank you so
Thanks.
much, Sandra.
Thanks, everyone.